Hey guys, welcome back. If you're joining me for the first time, my name is Dr. Ivy Branin. I'm a naturopathic doctor in New York City, though I'm currently seeing patients all over the states and all over the world via telehealth. And if you've been watching our videos, I highly recommend that you subscribe to our YouTube channel so that you are up to the latest in our nutritional and natural content. And of course, if you like the video, don't forget to like it. And I always try to do my best to answer all your great questions that you've been putting in the chat. So we're kind of continuing on with our discussions from earlier videos. And today we're going to talk all about pre-diabetes. We're going to be talking about dietary strategies, testing, and some natural treatments. So what is prediabetes? What is so different about prediabetes versus diabetes? So when we're describing prediabetes, what we're talking about is abnormally high blood sugar that is not high enough to be diagnostic of diabetes. Other names for this are impaired fasting glucose or impaired glucose tolerance, but more importantly, we want to kind of consider it as impaired carbohydrate tolerance. So yes, when we often think about pre-diabetes, diabetes, we think of sugar in the form of glucose, but we also want to think about carbohydrates in general. So what are some of the risk factors for pre-diabetes? Age. So age over 45 is highly predictive of pre-diabetes. Larger weight circumference. So often when we think about being overweight and obesity, we think of BMI, which is body mass index, but that doesn't really tell the whole story and isn't as highly reliable or predictive of diabetes and pre-diabetes. So when we're thinking about waist circumference, so that would be larger than 40 inches for a man or a male, or larger than 35 inches for a woman. So kind of what we're thinking about here is what we call an apple body. So having more weight around the abdominal is highly predictive for pre-diabetes. Dietary or diet high in sugar, especially sweet drinks and refined carbohydrates, and a sedentary lifestyle, so very inactive, not a lot of exercise, most of our work nowadays is done sitting, and so being very sedentary. And then of course, genetics definitely plays a part in whether one develops pre-diabetes or even diabetes. So what are some of the testing that we do for pre-diabetes? So one is a lipid panel. So a lipid panel measures cholesterol, LDL, which is considered the bad cholesterol, and HDL, good cholesterol. But what we're more interested in, specifically when it comes to pre-diabetes, is triglycerides, and this is a real marker of carbohydrate intake. So triglycerides being elevated. Fasting blood glucose. So we're looking for fasting blood glucose of around 100 to 125. As you increase that level, then you're reaching more diabetes territory. Oral glucose tolerance test. And so basically this is not typically a routine test that one would have during a physical with your primary care provider. This is more of a follow-up test based on abnormally high fasting blood glucose levels. And what it involves is giving the patient a sugary drink and then testing glucose 2 hours later. And a typical pre-diabetic range for an oral glucose tolerance test is glucose of 140 to 199. And then finally, the next test that would be highly indicative of prediabetes is having a hemoglobin A1C over 5.7, but typically below 7 or 8 is considered indicative of prediabetes. Now, what are some of the symptoms that one might experience if they have prediabetes? Of course, it's always possible not to have any of these symptoms, and it's also possible to have these symptoms and they could be associated with another condition. So the first is increased thirst, and along with increased thirst, you have increased urination, and this typically, both of these have a lot to do with the role of ketones that are higher, and also higher glycemic states, high blood glucose high glucose in the blood, blurry vision, fatigue. A lot of this has to do with muscle wasting and some of the byproducts of impaired metabolism, difficulty of concentration, kind of thinking of this idea around brain fog, and very similar, this abnormal levels of certain metabolites do have an effect on cognition. And then, interestingly enough, darkening of skin. So acanthosis nigricans is the darkening of the skin, and it's actually caused by excessive insulin. And when insulin is at high levels, it actually causes the skin cells to produce at a rapid rate, specifically our skin cells that contain melanin, which we might associate with like skin tanning or darker skin. It causes those cells to proliferate more. So it's another thing, and it's actually completely reversible once insulin and blood sugar levels are stabilized. And it's also something it's not always the primary driver of another condition, melasma, but melasma, which is typically usually darkening the face, and we associate with often pregnancy and hormonal imbalances. I also always consider insulin and blood sugar regulation when I'm working with my patients who have melasma. So what does pre-diabetic treatment? What is it? What does it involve? So first, let's consider what is the goal of pre-diabetic treatment. So you're going to say prevention of diabetes. Well, of course, that would be the one of the goals. But like I would say, even a more important goal is to normalize blood sugars on a normal diet. So we're not talking about like a modified diet. So that one should be able to eat a regular diet, nothing fancy, maintain normal blood sugar levels without medication. And so what we're thinking about is that we're trying to help the patient become no longer intolerant to carbohydrates. So that's the end goal, at least in my practice. Now, from a conventional medical standpoint, yes, there can be recommendations for referral to a registered dietitian, working with exercise, of course, but then there's often the pharmaceutical drugs that are prescribed for pre-diabetes, and the most common medication that is prescribed for pre-diabetes is a medication called metformin, and it basically attacks blood sugar levels by 3 avenues. One, it decreases glyconeogenesis. What is that? Well, if you watch any of my earlier videos, then you already know that our bodies have the capability of converting proteins, abstracting the amino acids from those proteins and making sugar, and that's typically done in the liver, so it's preventing the formation of sugar. It also affects the absorption of glucose, and this is probably why you have one of the side effects that I'm going to talk about. And then you also have improvement in general of insulin sensitivity. But of course, like with any medication, there are definitely downfalls and side effects of this way of dealing with a condition. So most patients that take metformin will experience some form of GI issues, whether it's nausea, constipation, stomach pains. It really can wreak havoc on the GI tract for a lot of patients, and a lot of my patients who have seen me have often been prescribed metformin, and they will have reported terrible side effects, and that was one of the reasons why they were seeking out a natural approach. The other big downside of metformin is B12 and folate deficiencies, and this can be specifically problematic because if we think about one of the main populations where metformin is readily prescribed is for women with PCOS, or polycystic ovarian syndrome. And many of these women, besides having menstrual irregularities and infrequent ovulation, many of these women would like to get pregnant. And one of our most important nutrients when it comes to becoming pregnant, maintaining a healthy pregnancy, is folate. So of course, why would you want to be taking a medication that's going to interfere with folate? So what would be more of starting off with a holistic, more natural approach? Let's look at diet. So what are some dietary strategies for preventing or treating pre-diabetes? So what is the pre-diabetes diet? So first off, just starting with elimination of the main offenders. What are they? Sugar, and we're talking about added sugar, not necessarily naturally occurring sugar, though I still put actually in the category of added sugar dried fruit and fruit juice, and specifically fruit juice. So interesting, I had a patient a few years ago, and she came to see me because she was pre-diabetic, and she was at least 50 or 60 pounds overweight for her ideal body size. And so when I was taking her dietary history, it turns out she was drinking a lot of apple juice. So just by completely cutting out apple juice alone, she lost 10 pounds, and it actually normalized her hemoglobin A1C and her fasting blood glucose just by that little change. Really interesting. And a lot of studies actually show that just sweet beverages tend to be one of the biggest culprits for pre-diabetes and diabetes. And it's just a simple thing. Just replace it with water. Just remember, fluids are just hydration, and we just really need to be hydrated with water. Maybe some electrolytes, that's another topic. Processed foods, specifically thinking about refined carbohydrates. Refined carbohydrates are pretty much just as bad as added sugar, and also elimination of alcohol. So if you've watched my sleep videos, you already know that that alcohol does have an effect on cortisol. Cortisol is our stress hormone. Also, alcohol has a big impact on insulin. So that's a really easy thing. We don't necessarily need to have alcohol. And then the other thing I would also put in this category of things to eliminate would be saturated fats. So saturated fats, specifically when you add them with a refined carbohydrate meal or a lot of added sugar, actually makes the whole problem that much worse. So now I know what you're already thinking. You're like, Dr. Ivy is going to be recommending the keto diet because the keto diet is the cure-all for everything. It's all about the ketogenic diet. Well, spoiler, I'm actually not going to go there, and I'm actually just going to touch briefly on why I'm not a fan of the ketogenic diet, just in general, and definitely not a fan when it comes to diabetes and pre-diabetes. And of course, probably some people have already unsubscribed, they've stopped because they just don't want to hear it, and that's fine. I'm just going to tell you my opinion, and it's a lot based on the research. So yes, it's true that following a ketogenic diet can cause dramatic weight loss, specifically initially, but the spoiler is the weight loss that you're losing isn't necessarily the weight that you want to be losing, meaning the majority, or actually all the weight that you're losing, is initially from water weight. If you've watched any of my other videos, you also know that our bodies store glucose for later use in the form of glycogen, and that each glycogen is connected to 4 water molecules, and that's why typically after a very large carb-heavy meal or carb-heavy day, you get on the scale, you're like, I gained 5 pounds. Well, mostly it's water weight. So when you end up losing your water weight, which again, that's not that significant over long term. I mean, if you're trying to lose weight, you're most likely wanting to lose fat, right? And then the other part is then our body actually loses muscle because, again, most of our cells' preferential fuel is glucose, and we already know that our body has the magic power of producing glucose from amino acids. Amino acids come from protein, and protein comes from our muscles. So you're basically just losing water weight and muscle mass, and a lot of that actually gets replaced with fat. So what's the point of that? So that's just like from a weight loss standpoint of how long term it's really not going to be helping you. So what is also the negative effects when it comes to diabetes and prediabetes? Well, again, if we think that, we remember our goal is to increase carbohydrate and glucose tolerance. Well, actually, the ketogenic diet does the opposite. It actually increases glucose intolerance by increasing saturated fat. And that was like why I added that little bit in the beginning when I was talking about things to eliminate was saturated fat. And if you already have maybe gotten a book on the ketogenic diet or you checked out a website, you know that's very, very high in saturated fat, and too much saturated fat actually impairs glucose tolerance. And then lastly, another downfall of the ketogenic diet is increased advanced glycination end products. So yes, these are very much associated with high refined carbohydrates and sugar. They're also, again, associated with saturated fat, and they cause a lot of damage, and just in general, they can lead to cancers, and also are highly associated with dementia and Alzheimer's disease. So you're basically increasing your ages if you're following the keto diet. Okay, so that's what not to do. So now what to do. So in my practice, my favorite go-to is the Mediterranean diet. And I always like to say, like, I apply the Mediterranean diet for a variety of different conditions, but I do a little bit of tweaking based on the condition I'm applying it to. Why I like the Mediterranean diet is whenever I'm recommending any kind of diet, I prefer that it's something that one can be used long term, can be used in most settings, is relatively user friendly, and supports or emphasizes a lot of unprocessed foods and fruits and vegetables. And that's what I really feel with the Mediterranean diet. And so kind of like from a diabetic or pre-diabetic lens, the foods that I'm really emphasizing on, like if I was going to put them like in a little bit order, so seafoods and legumes, so making those the primary protein sources. Legumes meaning beans and lentils, and these are vegetarian proteins that are, not only do they have protein, but they are very high in fiber, which has a benefit on blood sugar and insulin. Then the next part of that foundation is vegetables, and the goal with most of my patients, I would say, would be going towards 4 to 5 cups of a variety of vegetables, because the more variety of plant products we have, or the plants that we eat, is actually also beneficial for our microbiome. And that's like probably a whole other story. We don't need to get into all that, but a healthy microbiome also plays a role when it comes to glucose metabolism and insulin. So getting a wide variety of vegetables, nuts and seeds, very important. Good sources of vitamin E, healthy fats, so having a good basis of nuts and seeds. Grains, so again, choosing grains that are whole grain versus processed, choosing ones that are high in fiber. Depending again on my patient's goals, I will usually steer them towards serving amounts that make sense for their case. And then lastly, fruits. So most patients that I'm working with prediabetes, my recommendation is typically, keeping it to 1 to 2 servings and being very choosy in the fruit category. Mostly I really like berries. One, they're lower in the glycemic index, they're high in fiber, and they're also high in phytonutrients, specifically because of the purple color, cyanidins, so they're very high, and also resveratrol, so really good overall. So now let's talk a little bit, okay, so we've talked about diet, let's talk about supplementation. What are some of the supplements that I often prescribe for patients with prediabetes? And if you're wanting the specific products that I use in my practice, one, if you don't have a full script account with me, sign up. You'll get 10% off your first order. And then it's so easy, once you have an account with me, all you have to do, whenever I'm talking about any supplements, vitamins, minerals, herbs, all you have to do is click on products, favorites, and then select the category. In this case, we're talking all about blood sugar support. So all you have to do is click into my favorites for blood sugar support, and you'll see all my favorites. So the first one, and it's a constituent, meaning it's a component of an herb. I kind of classify in the herbal category, is berberine. So berberine is a constituent of Oregon grape and golden seal. It's originally touted mostly for its antimicrobial benefits, but it also has a great impact on blood sugar and insulin. And mostly, actually, it helps to promote healthy blood sugar levels by increasing sensitivity to insulin. It also has an impact on certain enzymes that digest carbohydrate, actually reducing the digestion of carbohydrate and the absorption in the small intestine. So you're going to be having less glucose entering the bloodstream and creating havoc. And studies really support the use of berberine in that it can lower fasting blood glucose levels. It has been shown to decrease hemoglobin A1C and also insulin. So that's berberine. That's probably one of my favorites in this category. The next is, it's like an herb, it's also a food. That is Momordica, which is more commonly known as bitter melon. And if you've ever had it, it's very common in Asian cooking. I had it once when I was in Japan. Not gonna say I really liked it. I was definitely not a fan, but you have to try everything. So this is the herb that you can actually incorporate as food, and it is very, very bitter. But it does, besides the fact it's bitter, it has been shown to lower blood glucose, mostly by promoting blood glucose utilization in insulin-resistant cells. Now, interesting, you can definitely take this as a supplement, or you can also incorporate it as food, but one of the interesting things is that there has been research kind of showing that part of its action in regulating blood glucose and how it can promote activity along our digestive tract is because of its bitter taste. Why I bring that up is that possibly just even the incorporation of more bitter foods in one's diet probably has a benefit on insulin and blood glucose. Just putting it out there. So as another aside. Now I'm going to talk about two of my favorite minerals, specifically for blood sugar and insulin. So the first is magnesium, and magnesium comes in so many different forms, and it's probably one of my most prescribed minerals. So forms like citrate and oxide also have the added benefit of promoting bowel regularity. Also, magnesium glycinate tends to be better for sleep, and I like it also for mood disorders. There's also threonate. There's all different types of magnesium, and I often, in my practice, I try to choose ones that make the most sense for my patients. I also love magnesium malate, specifically when there's musculoskeletal pain or issues. And magnesium, why it's probably so commonly prescribed, is that it's actually required for almost like every single biological process in our body. So it's not surprising that it does play a role in glucose metabolism, mostly by facilitating the movement of glucose into the cells and also aiding in carbohydrate metabolism. And then last but not least, probably one of the most famous supplements for pre-diabetes would be chromium. And if you've seen any of my videos, usually I prescribe the picolinate form, and I'm dosing anywhere between 200 and 500 milligrams 2 to 3 times a day, depending again on the patient and our goals. And what chromium does is it increases insulin binding. So everything it does is it really has a big impact on insulin and how it works. It actually increases the number of insulin receptors on cells. So like receptors are these little things that are outside the cell, and different molecules, it's working with signaling and telling the cells what to do. So they're very receptive to insulin. So those are all the supplements. And again, I highly recommend checking out Full Script for all your supplement needs. So lastly, let's just do kind of a recap. So what is a natural cure for diabetes, or pre-diabetes, and like what is the approach? So definitely if you're working with me, my first look is definitely dietary changes. And sometimes, again, as I mentioned before, that patient, just by cutting out the juice, normalized her hemoglobin A1C and glucose. So it could be that simple, by just cutting out the main offenders or adopting a Mediterranean style diet. Stress management. So stress is a big one. It's unavoidable. If you want to hear more about stress and my stress approach, definitely check out my videos on adrenal fatigue, anxiety and acne, anxiety and hair loss. A lot of these videos talk a big part about how stress impacts the body and stress management. But the big thing when we're thinking about stress, we're thinking about cortisol, and then we're also thinking about norepinephrine, epinephrine, adrenaline, basically, and how that all plays a role in glucose and insulin. Sleep. So sleep is a big one. Again, I have you want to watch my Better Sleep Now sleep series, which is all on my YouTube channel. So the big reasons why, well, actually there's a couple of reasons. So one of the things that during sleeps is if we're achieving deep levels of sleep, we're having a lot of repair. And if we think about some of the mitochondrial damage and oxidative stress that can be accumulating during the day, or also as a result of our diet. So sleep is going to be really important for repairing those functions. But the other big thing is the regulation of 2 other hormones, leptin and ghrelin. All you really need to know right now, or in this video, is that with lack of sleep, leptin goes down, which is our hormone that makes us feel satiated and not want to eat as much. And ghrelin, which makes us really hungry, goes up. So if you've ever noticed that when you're sleep deprived for various reasons, you feel more hungry, or also you're much more wired, not just hungry, but all you want is fats and sugar. Well, you can thank sleep disruption causing havoc on ghrelin and leptin. Exercise. So definitely, unfortunately we live in such a sedentary world, and it's even gotten worse with the pandemic because we're all inside. So exercise is really important for the utilization of glucose, and it doesn't even just mean getting to the gym. Definitely, taking our daily walks. Also, if we think about too the importance of stress when it comes, exercise when it comes to stress management. But the other thing that you might want to start incorporating more is just the simple act of standing. And so if you have access to a standing desk, even if you don't, you can even make one just by taking any standard table and just propping up your computer, possibly on some books, or actually how I have my my iPhone set up right now on top of a yoga block. Really, really simple. But just the act of standing more will help to actually break down more body fat through lipolysis. So it's a very easy little hack. And I would say that the last part of that layer would be supplementation. And my preference is always more emphasis on the first 4: diet, stress, sleep, and exercise, and then just kind of picking up some of the slack with some supplementation, specifically if glucose and hemoglobin A1C are really, really close to the diabetic level. Anyway, that was a lot, and hopefully you got something out of that. And don't forget, if you liked this video, please don't forget to like it. If something was confusing, just put a comment in the chat. I'm happy to answer that. And of course, if you're wanting to keep up to date on all the latest in women's health and hormones and a natural approach to almost any condition, please don't forget to subscribe to my YouTube channel. Well, thank you so much. Hopefully you'll join me again, everyone. I'm Dr. Ivy Branin, New York-based naturopathic doctor, and working with patients remotely all over the States and all over the world. See you next time.